I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery, and welcome to this video on stromal transplantation to treat or reverse corneal scarring. It's a pretty significant case of corneal scarring in a young patient, and I see these people all the time for many different reasons. They come in, they are anything from terrible vision to bloody terrible, legally blind, and they're frantic. They're young, they're middle-aged, they're older. No one wants to lose their vision. Unfortunately, what happens is they often come in with vision loss from a contact lens, whether it's a crazy contact lens or just misuse of contact lens, and they're remorseful. I literally just operated on a 14-year-old for this problem a few weeks ago. So here we go, and we'll have a look. Here's that cornea, and you can see straight out the cornea the eye doesn't look nice at all. And in fact, this person has very poor vision. So we start by marking it. The thing about the scarring is I don't know how deep it goes. The cornea is thinned, and as you'll see, blood vessels grow in, which makes my job really tricky. So we start the dissection here and prepare. And as soon as I put the draphan on, look at the blood coming out. It's everywhere. And that makes it really difficult. As I said, I don't know how far the scar goes. It goes all the way through. Has it damaged endothelium, the deep cell layer? I don't want to do a full transplant with all those blood vessels there. If I do a full transplant, this person's going to lose the transplant. So I really want to do a layered transplant. And the way I explain it to patients is if I can get you to driving vision, that's better than legally blind. It may not be 20/20. So what I do is I dissect it off, and lo and behold, there it is. So we slowly keep peeling down to decimase. Just do it slowly. But that's not the difficult bit. The difficult bit's coming up. So we get the tissue, and here it is being prepared, and you'll see I remove the cell layers off the back because we have a layered transplant. Haven't gone in the eye. The eye is beautifully sealed here, so we can put this transplant in and get a nice shape. The difficulty comes is there's blood vessels everywhere, and that's going to cause all sorts of inflammation. So I've got to put lots of stitches in, and getting the stitching right is difficult. You'll notice you can see a pupil here. Straight away, you can actually see into the eye, and this patient could see day one. Very, very happy patient. It happened because of a contact lens, by the way. So it really took me a long time to suture this. Had to put lots and lots and lots of stitches in to get it right, to get the shape right. And this person will have a pretty stormy course afterwards with all the blood vessels causing inflammation. But with the right use of drops and the patient being diligent, we'll get her there. All right, it does take time, and patients are all wary that it does take time. So basically, here's a quick run through. The most common things I see is there's surface scarring, which is Saltzman's degeneration, which can be treated by laser. Don't need to transplant. There's superficial, so it's not on the surface, it actually goes into the top part of the cornea. Typically, pterygia does that. Generally, we don't need to transplant. We can use a laser or surgery to polish that off. But then there's multi-layered scarring that goes all the way through the cornea, and sometimes you can get blood vessels, as you just saw. Usually things are infections or an injury, someone gets a poke in the eye, or herpetic disease. In most cases, we can do a layered transplant. Sometimes I have to resort to a full transplant. Not my favorite way of going. So that's it. I hope it makes sense for you. This is an application in a very difficult situation to restore vision. And once it settles, hopefully that patient will take the transplant to their grave. I'm Dr. Anthony Maloof. Thanks again for watching this version of scarring and stromal transplantation for scarring.